Hello, this is Dr. Marc Rothenberg, and I'm pleased to have the opportunity today to interview Dr. Pablo Abonia of Cincinnati Children's Hospital to talk to him about his latest findings concerning eosinophilic esophagitis and its relationship to connective tissue diseases based on an upcoming paper in the Journal of Allergy and Clinical Immunology. Dr. Abonia, could you please tell us briefly about your findings?
Well, hello, I'm excited to be here today to talk about these findings. And the primary finding of the paper is to go ahead and look at patients who have eosinophilic esophagitis, as well as a connective tissue disorder, meaning things like Ehlers-Danlos syndromes, Marfan and Ehlers-Danlos syndrome. In particular, what we found is that these patients are overrepresented in our EOE patient population. And as a consequence, I think it's rather important for us to have a good understanding of what's needed to do for their extra care.
Okay, so you're saying that your findings, which are related to the association between eosinophilic esophagitis and a higher prevalence of connective tissue diseases. Do you have any ideas in your study about what causes this association?
Well, I'm not entirely sure why there's a definitive association here. However, what we have seen is that there's an overrepresentation of certain genes that are associated with connective tissue disorders here, meaning fibronectin genes, the TGF-beta receptor genes, have both shown up in this patient population at probably what is an increased frequency than what would ordinarily be expected. So I don't have, while it's not specific, it does give me a sense of, yes, these are probably related to the problem.
So just for the clinical people out there, what would these patients look like? Do they look like run-of-the-mill patients with eosinophilic esophagitis, or is this a special type of appearance, a phenotype?
I think there is indeed a special phenotype for these patients. One of the things that you'll see is they tend to be taller, they tend to be narrower. So even though we had a limited data set, what we saw was that their BMI was actually lower than that for the regular EOE patients, meaning those EOE patients who do not have a connective tissue disorder at the same time. And as a consequence, the things I look for when I'm trying to say, do you have a connective tissue disorder and EOE, or do you have just EOE without the connective tissue disorder, is their patient's height, whether or not they're unusually flexible, which is probably one of the more dramatic things that you'll see. And one of the easy questions I oftentimes ask, are there any tricks that you can do with your joints? And if they can, that makes me much more suspicious that there's a real problem with a connective tissue disorder rather than and EOE rather than just EOE alone.
All right. So patients with EOE who have increased hypermobility of their joints should be suspected of having this new syndrome that you're describing in this paper.
Sure. And the only other things I'd be concerned about for these patients is whether or not they'd have any sort of heart defects that might be problematic, meaning things like aortic valve dilations, as well as also thinking about what's going on with their joints, because they tend to have more issues with their joints long term. So I think they deserve to have a little bit more done from them on the clinical side than your ordinary EOE patient that you would see.
Okay, thank you very much.
Thank you.